Um, Bob worked for 30 years as a psychiatric social worker who trained other therapists. Bob traveled the country as an advocate for a single payer system that supports healthcare for all. Uh, uh, Bob shares Gray Panther's concerns about Donald Trump's attacks on our current healthcare systems. And so at this point, I'm going to say welcome, Bob, and welcome to all of you who've joined this call. But very grateful that Bob can join us today and help us look at these two big subjects, healthcare, the threat to healthcare now, but the vision for healthcare in the future. So take it away, Bob.
Okay. And I guess what I was saying before leads into that because it's the same kind of blueprint. What is that blueprint? They're going to take all our tax dollars, the little guy, everybody's tax dollars, and give it to the wealthy while making us suffer more. That's what happened with Medicare D and other programs that happened during the Bush administration. What is happening now is it is very clear that they are attacking programs that help most of the people in the United States. Randy sent me an article from Federal Scoop. It's a Center on Budget and Policy. And what it does, it outlines the plan of this current administration, the Republicans, what they want to cut and where they want to cut it, at least in 4 areas. The first is housing and agricultural. They're looking at cutting $22 billion over 9 years. What does that do? It gives food assistance. It gives SNAP to low-income families. I wonder if Focus Hope and the folks who get that federal food from farmers, if that's going to be affected. Most likely. Again, there's no definite plans, but that is their call for their duty, in other words. The House of Energy and Commerce, they are over Medicaid and other health and emergency programs, energy programs, sorry. They have to cut $880 billion out of their budget and shift it all to the states. So what are we talking about? We're talking about health care for people who do not have regular health care. They're working low-paid jobs. They may not be working at all. And also possible it's going to affect the money that goes to nursing homes because that is under the Medicaid dollars. And that's what supports a lot of the people who are in nursing homes. Again, the shift is going to go to the states. The other place is the House of Education and the Workforce. They're to take out $330 billion. These cuts are to children's nutrition and education. We saw that our governor and the legislature was able to give every kid in school breakfast and lunch. I can tell you from seeing some of the kids in the school around here that that's very important. The kids are getting up willing to go to school. They want to be there in time, so they have their breakfast. Again, without that, we know that if a kid is hungry, it's very hard to focus on a math problem or an English problem. It's going to be very hard to educate if people are sitting there with their little stomachs not full. And then the last thing, this one comes from the Ways and Means Committee. And what they want to do, their job is to be able to extend the tax cuts of 1.1 trillion. Again, 1.1 trillion of dollars to the top 1% in this country. So what's at risk? Medicaid programs, SNAP programs to low-income people. That is what is at risk here at this point. Now, our president has said that he will not touch Medicare or Social Security. That's what he has said. There's no indication that he's called for that yet, but I'm sure that if these things go through, we're looking at that being a possibility too. We do know this. We know that Medicaid, there was a program that was started 10 years ago, and I'm sorry, it's the tax cuts that were started 10 years ago, and they're due to expire in 2026. That's why they're going through this budget right now so rigorously, trying to chop things off of people, common people, to support the 1%. That's what we're talking about. Tax cut, major tax cuts for the 1%. Anything else in that equation is minute compared to what these billionaires are already going to get. One thing I'd like to point out is that in the Bush administration, when they began, Forbes was advertising millionaires. By the time he left office, we were posting billionaires, we were in a huge debt, and we had more children being born in poverty than even during the Depression. So I think it's hard times that are coming, and what we can do to try to influence the Republicans and the Democrats to vote the right way, I think we need to do that. Can we do anything now about what we see happening now? Can we take some questions and try to answer them before we go into what could be a solution?
So does anyone have questions here for Bob Sisler? He's talking about the proposed major cuts. I see Darcy. And
There. Yes, I'm working with National Nurses United, save Medicare from privatization and do Medicare for all because it's going to be reintroduced probably in March, in early March. So we're doing a massive national program of house parties, et cetera, to educate people and get them writing letters and marching in the streets and screaming. So they also, from what I understand, the privatization thing of they're privatizing Medicare completely, and they intend to do away with it in the next project. Because the first project, this is project 2026, project 1981 started the ball going. That's why many things that Clinton and Bush and Obama, and not so much Biden, but all the presidents did things for the project plans from the billionaires. That's why they have this big plan that keeps rolling for 50 years. And it seems like we need a big response. So I'm wondering, is anybody in Michigan working specifically on any plan, or would people want information on how to join the National Nurses United effort, which you don't have to be a nurse to join?
Yes, well, our group is working very closely with Physicians for National Health Care, which is, they're the co-sister and brother, co-sibling,
Right,
I guess is the proper word.
It's a joint project.
And are you aware of May 31st? What's happening? We were on a call last week, and they've taken May 31st, and they want to have actions around this country. On the call, from what I could see, we had people from from the West Coast to Alabama to Vermont, all across the country, and they're trying to have an action day where you do it locally. So the action would be at a local event that whoever the planners are would do that. And by having the local action, hopefully we'll get national coverage from all the states. That is their hope. And we got some time to work on it, but I think we have to, because I agree with you. It's horrible what's going to happen. And privatization They've already began it with that Medicare Advantage. They're milking all kinds of money out of the Medicare trust fund.
No, I didn't hear anything.
Can't hear anything. Coming.
Oh,
Okay,
they can hear. Okay, are we okay to go?
yeah, I think it was Nick was talking to somebody else in this
Oh.
house.
I'm sorry,
okay.
that was on mute.
Okay.
Yeah,
All right.
yeah. Well, I see that first that there's a couple people that had their hands up. It's Mary Jo Ebert, and then Nick.
I'm gonna pass for now.
Okay. All right, Mary Jo.
Yeah, good morning, Bob, and to everyone else.
Good morning.
Bob, when you say that the Medicaid will shift to the states, can you say a little bit more about what exactly that means?
What has happened, especially under Obama and the COVID event, there was a lot of money that was given to the feds, from the feds to the states to set up different programs. I know that in our state, they expanded healthcare to people with higher incomes than they did pre-COVID. And all that money went to the states to help with things like AIDS clinics, public health clinics, things like that. And that's under scrutiny at this point. They're trying to draw the money back and say, okay, now you states take care of all of it. Now that's going to make huge tax increases if they maintain that, but most states probably won't be able to do that. Even under the expansion plans that were done under President Obama, those things can be all drawn back, and it seems like they have the power and they may be doing that.
So that federal money comes from taxes paid by people in each state, right?
Yes.
So does that mean that instead of having to send that money into the federal government, it would be retained in the states?
Nope. What it means is they're still going to take the tax dollars into Washington. They're going to take those tax dollars and try, and that's what they're doing. They're trying to see where they can take this budget, not send the money to the states in order to give tax breaks to the tune of $1.1 trillion to 1% of the people in this country. So what happens is it just dries up. There's going to be no extra money coming from the state. Those programs are going to be cut. That's what they're talking about.
So it shifts back to the state with no funding. Got it. Thank
Got
you.
it. That's it. Any other questions? Okay. And you know, I think we're in the situation we're in now because we didn't listen to things in the past, you know. And people just didn't respond. They responded to something else in this past election. But now let me shift to what we may be able to organize people to demand in 2028 at the next election. I began working with Medicare for All in 2005. When I first started, I was told by Conyers staff that we'd have to listen to this plan about 3 times because it's so incredible. And when I look back, it was so incredible because I had become to believe in Blue Cross Blue Shield. Well, the basis of Blue Cross Blue Shield was always to provide care. The doctors got together, said, you'll put money into this fund, we'll guarantee you so many days of hospital, and then it went into treatment, etc. But it was in order to provide service to citizens, to their patients. What happened was corporations saw a way of taking this stuff over and denying care and making profit from it. And that's hard to put your hands around when you know that, or when you were led to believe that these were things that were going to take care of you in your lifetime. We have a problem with healthcare being in the market. As we know that if a corporation is in the market, their responsibility is not to the product. Their responsibility is to profit and to their stockholders. So what has happened is the corporations are looking at the patient as a product, and they have to maximize the profit for the stockholders. So that's what you're up against. So what we have is we have a system whereby denial and delays, people are killed. That comes from Social Security Works, that's a national organization. And we see it. I just went to a funeral of a young guy who just couldn't navigate the healthcare system, didn't get treatment for his prostate cancer, and died. And that's one of many stories. I mean, sure you guys know all of them too. So we are now promoting a national Medicare for All program. What do I base it on? Why would it be good for the country? Well, the Congressional Business Office comes out and it tells us very clearly that this healthcare plan would help more Americans than all. It would provide healthcare for everybody. It would give the states, every 50 states, a budget of 3 years where they would have money to do other things, work on roads, etc. The system itself is broken, and by taking out the administration, you can provide health care for everyone in this country. Let me point these facts out, which we've gotten from P&HP. It says, why is Medicare for All important? We spend twice as much as any other industrialized nation, yet we rank at the bottom of healthcare indicators like life expectancy, which just went down in our country, and infant mortality rates. Around 27 Americans still have no health insurance, and another 23 Americans are underinsured. Just because you have health care doesn't mean you have access. With the UAW, we had, before Sean Fain, there was these different tiers, and people who were making $15, $16 an hour were working next to people who were making 30-some, and yet the people who were making 30-some had health care because they had signed in earlier with, more reasonable deductibles, like $20 when it goes copay, and deductibles around $400 or $500. The person who hired in later, their deductibles are $5,000. And the people would talk to us and tell us, we pray that our kids don't get sick. And they don't utilize that health care. They go to free clinics when they're given. Wayne State has a group that goes around that gives free healthcare analysis. So those are the things that are at risk now, because that was most of that was done with federal money. Okay, the other thing is most U.S. household bankruptcies are due to medical bills. Most of those households had health insurance. So 4 in 10 of the insured adults report having healthcare debt. I brought this up at a meeting and people challenged it. But do you know that you could have your house, you can have your bank accounts, and if you have to go into a nursing home, you may have to sign your house over. And in order to switch, and we've seen this, when we went on a national group, there was a insurance person. And we said, why are you here? And he said, and this is back in 2005, he said, I had millions of dollars. He says, my wife got sick. And the long-term care, I spent it all on her. Our insurance only go to a certain limit. And then I had to sell everything. In order to, and you love somebody, you're going to do that. The way our system is set up, which is different from other industrialized countries, is that if you are sick, you can have $2,000 in the bank when you go to apply for Medicaid to help you in the nursing home. You cannot, if you have property, you have to sign it over to the state. Sometimes they will pull on it or sell it and get rid of it to cover the debt. Sometimes they don't, but the fact is you have to sign it over. And you can't have any other assets except for a prepaid funeral and cemetery bill. So we have to recognize this is not a just system. It brings tension, mistrust, and hate into the system by its own design. The next thing, our prescription drug prices are the highest in the world. We all know that just by being so close to Canada, and the same things you get here are usually twice to three times more than what they are there. Each year, $1 trillion of healthcare goes to the administrative costs. So that's 31% of all the money they collect from our insurances, the companies, etc. So why is Medicare so important? A single payer plan is a universal healthcare system with the government as the payer for care. Privately run, publicly funded. The single payer plan, like Medicare, can cut administrative costs in half. Some estimates that it will save $700 billion annually. The single payer plan also will negotiate drugs and medical device prices, saving about $150 billion a year. The savings are more than enough to cover the health care for all Americans, including dental, vision, and prescription, with no copays or deductibles. Funding for improved Medicare for all systems would be less than the current health care expense for 95% of households. Anybody, was there a question? Okay, I'll continue. What we have to realize is we put a lot of money into the system. For example, the when you pay your copay or your premiums for your insurance when you're working with someone, the company's also doing that. The company is, you can say, well, that's an expense they can get rid of. But what we have found is that expense is a tax write-off for them. So it's easier for them to keep it going the way it is because they get a tax write-off and they get their health care some other way, So for them, the business is set up that it's a tax write-off for them. So if we put all that money that we're paying here into the system, we do really provide for everyone else. It says here, employers' funding is the majority of healthcare in the United States. It says here, private businesses fund less than 20% of the total cost of spending. Government employees have tax-paying funds covered through the FEHBP program, and the employer payment is private insurance received at a substantial tax subsidy. So the idea that they have this tax subsidy is what keeps the companies not joining in with Medicare for all. I have a book. I'm going to try to show this. I hope you see it. It says Healthcare 101, a conversation about healthcare. This was written by General Motors and the UAW back in 2005. And it talks about all the myths about the best healthcare and everything that I've just said in this book. The conclusion of the book is that government has to be involved to reduce the cost so that people will be healthier, and that it would be a less of a cost to companies and everyone else. I was in a room in Solidarity House back then where they were passing out these books, and they were slated to pass it out to every General Motors employee. These books were never passed out. They don't want the information out there. They don't want people to know that it's a better healthcare system than the present one that we have. During that time, Marilyn Clemens from Healthcare Now, along with John Conyers, got us to set up an appointment with the stockholders of GM because we saw this book and we thought, oh, we can really get this moving about single payer. We found out that there were 3 executives on the board that were also on the board of healthcare companies. So it was not going to pass. The interest here is money, not patients. So we have to be very, very cognitive, very insightful, and be aware that the stuff they're going to tell us is, it's like the trickle down effect that we've heard about for years. Don't fall for it. It's a myth. The other myth they have is the rising number of elderly Americans will bankrupt a single payer system. The fact is, Europe and Japan already have large portions of the elderly that America will face with aging baby boomers. Germany and Japan have adopted a single payer program. Long-term coverage, precisely because of the single payer plan, has a greater potential for efficiency and cost containment. The other thing is they don't have people getting as sick as we do. Because of the denials and delays, we have more people going for health care when they're already chronic. When instead of stage 1 cancer, they're going in at stage 4. So that takes more money into the system than if we would take care of it earlier on. Making people more cost conscious is the best way to control healthcare costs. That's a myth. The United States has the highest healthcare costs, even though Americans pay the highest out-of-pocket costs than any other nation. Again, we stand in fear of going to the doctor because of the cost. We are told these are co-pays, deductibles, and like my seniors will tell us, it's a surprise bill they get you. And then they're telling you, oh, it's covered. Oh, yeah, it's covered. But out of this $5,000, we're only covering $500. You're responsible for the rest. That is what our healthcare system has become. Again, think of yourself as a product, not a patient. National health care, this is a myth. National health care would require larger new taxes. No, the increase of the total spending needed to finance a single payer system. The increase in taxes required to finance a single payer system would be fully offset by a reduction in the out-of-pocket cost and premiums. When we would go out to talk, we would tell people, figure out what you're paying for your premiums, figure out what you're paying for your copays, figure out what you're paying for your medicine, and then go to your FICA and double that and see if you're going to save money at the end of the year. That's what it was then. The money's a little bit different now, and it may be even less at this point. The U.S. and see, here's the other thing. When you have, let's say these house insurance, AAA takes that money. For example, I'm using AAA because that's what I have. But AAA takes that money and they invest it. They invested in selling annuities. They invested in the stock market. They take your premiums and put them into investments in order that they can draw on them when a tragedy does occur. Okay, What they're doing in healthcare is they pay the bills and they're sending this money instead of investments to the CEOs or to the company or to the stock market, to the stockholders. That's what's wrong with our present healthcare system. And last, converting to covering the uninsured is unaffordable is the myth. The fact is 31% of current healthcare spending is squandered on administration tasks related to our fragmented payment system, with hundreds of people asking to try to retrieve co-pays, deductibles, and not investing in patient care. About half of the money currently spent on overhead and bankruptcy could be saved with a simple single-payer administration, enough to cover the uninsured. Cover the uninsured is affordable and keeps current private insurance system intact. Not intact, sorry. So the bottom line is we have to begin preparing for a single payer system. The only way we can do that, and we've discovered that in our groups, there's been all these rallies with the representatives and talking to them and try to get them convinced to pass the bill. We've come to the belief that we have to educate people. We are going to try to do as many town hall meetings as we can. We're going to try to get our message out because we know that if people are not truly informed, if they're not equipped with the knowledge, the other side has the ability to propagandize, stretch the truth, if not out and out lie, and we will continue this for-profit system which kills people by denial and delay. As was noted already, May 31st, we're going, at least in Michigan, we just got this notice last week, so we're going to try to develop some kind of local action in this state. I don't know what it'll be, but it's to be determined. If you can try to learn about that, that would be helpful. The next educational session that we have scheduled with our group is going to be on May 26th, which is a Saturday. It's the Saturday before May Day. We were trying to pick May Day, and I'll tell you why. President Sean Fain of the UAW has talked about May Day 2028. He's wanting to call for a national strike. There were three things that he wanted people to gel around, and that is raising the minimum wage to living wage, Medicare for all, and having the wealthy pay for the education of all people in this country. To get to that end, we feel that we have to educate so people know why they would even be calling for a national strike. It seems like that kind of momentum is building across this country. We have people walking out, demonstrating, both for wages, but also just for some of these ridiculous punitive policies that this administration is bringing out. So we want people to be educated when they go to talk to to the representatives, because if they're not equipped, they won't know what they're asking for. They just won't, and it'll be very easy for them to get tricked into believing something that's not true. So with that, our event is going to be at the Cherie Thanador Community Center, which is on Livernois in Detroit, south of 7 Mile. It'll be on the 26th. It's going to be from 2 to 4 in the afternoon. Refreshments will be served, and we'll have 2 guest speakers, doctors from PNHP. And our plan on this time is to see why people are suffering and why we need a different healthcare system. So that's our next planned event. We will definitely be planning something for the 31st, and we'll get that out to you as that becomes available. That's pretty much my presentation, unless you have questions or discussion. Hello?
Well, this is a perfect time for those of you. I see Dave got his hand up, but this is the opportunity for everybody on this call. If you've got a question, we've got you another 15 minutes or so where you can get your questions asked. And we appreciate that Bob is here to help us with that. Dave?
Bob, would you go by where, tell us again what I know it's in Detroit on 7 Mile, but tell us the date and where and how you go there.
Okay, it is the 26th of April. I'm sorry, I should have said that.
Yeah, okay, thank you.
It's the Saturday before Labor Day. Not Labor Day, the Workers' Day, May Day. In the Catholic Church, it's St. Joseph's Day, because of the fact that he was considered the patron saint of the worker. So that's what's going on that day. It's from 2 to 4. There's going to be refreshments. I don't have the address, but it's on the internet. Sharice Anador's community center, and it's just south of 7. And that's about it. Did that answer your question?
Thank you.
Okay.
Okay. Who else has got a question here for Bob? We're talking about a vision for the future here. Yeah, I see Darcy.
Yes, I wanted people to know, and I just put a message there, I think I did, that the National Nurses United PMHP is working with Bernie Sanders on the same thing, but we're doing it right now. We're not waiting for the May Day, because Senator Sanders intends to introduce Medicare for All bill again sometime in March. So we're working in February to do house parties, which could be like yours online, where you activate people and get them sending letters. And we have letter writing help. We have training videos. We have everything ready for anybody here that wants to join us. Put your info there to me in the chat, and I will gather up an email list and send you all the stuff I've got. Like I said, we have training, we have materials all printed out. So there's house parties, there's rapid response where you immediately send things out to a list of people that you're given and add your own if you want. Or you call yourself, start calling your list of lawmakers that you're asked to call, etc. And we intend to get so many people informed. So this effort is going right along with Bob's, the one he's involved with. It goes right along with that. We're getting people informed in February through people that they know, because that's important. It's not on paper, it's not an email, it's not a magazine article. People are going to be there. And we're also gathering stories of people who were harmed by the current system. So people's bad experiences with the current system, and if that's the only thing somebody's able to do now, that's a good one, because we're going to read those at these meetings. People are going to hear about people who were harmed. And they're probably going to be on videos too. So I just wanted people to know that.
Can you give that date again? And is there a location yet?
No, everybody picks their own house party. It's up to everybody else. And we have training on videos. And then there are teams in the NNU who, if you contact them, will help you with questions setting up. If you want to set up a house party at your local Democratic club, even, which I might do, among other places. Also, our campaign office. I work for a local campaign. And I'm a nurse practitioner, by the way, and I've been working with NNU and PNHP since 2004 on the campaign. And yeah, it's been discouraging, really discouraging.
Excuse me, one more question, Darcy. What What month are you targeting this for, though, for the house parties?
February, March,
March,
still in March.
March, okay.
And we have more going on, because what we want to do is, we will have all these educated people across 50 states, right? Everybody even educates 2 people a week that of people they know with the material that NNU and PNHP provide. By the time they take that vote, that's when the rapid response team gets the info out to everybody on our list and everybody that we personally all know, and they send it to everybody, and everybody goes, look what my senator did. Oh my God. You know, we're going to wipe you out. You're not going to get elected again, because they know what it is and they know what they voted for them. People aren't educated.
That's it. That's it. That, and you know, we are being asked to do even more. Debbie Dingle office has asked us to do something before that April date. So we will be having other town hall meetings, educational sessions, whatever. There's even a possibility of us having some video time showing Sicko or Healthcare Now, the movie. You know, anything to get people educated. And believe me, you get it in a group and somebody's got the story, the tragedy of what this healthcare system has done to people. It's sad. It's sad.
Because I want to say that we are collecting stories now, and people are getting
Good.
trained for various roles that they might want to try out and then pick one or pick both. Now we have training now, and we have materials now, and we are ready for March. So if anyone wants to join up, you can let me know, and I'll send the material out, or just even a link to the whole site, etc.
Have you, and I don't know about this, Randy, have you guys talked about the Medicare Advantage programs and how they're ripping money out of the Medicare Trust Fund?
That's definitely part of the education. We've been educating people on
Good.
that for decades, and ever since it started. But now the plan, which, as we know, I mean, this was their goal from
Right.
50 years ago, and they've about got it. They intend to do away with Medicare completely by 2030 by privatizing it and breaking it. So we may only have it 3 years or 2 years, even the way they're going and the way the corporations raise prices. So yeah, they intend to do away with it. So definitely, that's a big part of the education to tell people why, why that. But 73% of people polled, I think that was something that Michael Moore was publicizing, and he gave the polling links to all the detail. 73% want Medicare for all already, or something. When you describe what it is, they want it.
Oh, yeah. When we're out there, they said, how can I sign up for it now?
Exactly.
That's what we get. Maybe one thing I should mention, if you are offered a Medicare Advantage program, you have to be very careful, because if you come out of traditional Medicare and you get into, let's say, Higera or one of these Medicare Advantage programs, and then all of a sudden they're not covering what you need under Medicare and you pull back out, you may not be able to find a company, because no longer would they be okay. Let's say you come out, you're looking for a provider to give you that 20% coverage that is not covered, and when you look for that, they will not be demanded by law about pre-existing conditions that they could actually deny you because of pre-existing condition, because you had already pulled out of your Medicare Advantage. I tell people with the state and with the VIBA, which is hooked up with the auto companies, those are being managed by someone, and they've already been told, and we've been told by the state, that if we are pulled out of there, they will, and we were told to keep our traditional Medicare card, because if they pull out and stop providing some of the extra services, they can still put us back into Medicare and give us a someone to manage the 20% if the state won't do this themselves. So it's very important to watch. Don't actually, and I tell people this all the time. Don't be fooled by them buying you a tube of toothpaste. You may be losing something in the bigger picture.
I see Dave.
I hate to say this, but I was in a meeting. This has got to be 12, 15 years ago. A very small meeting with John Conyers, Congressman John Conyers, and there was only about a dozen of us. And I don't think I asked the question, but somebody asked the question, "What do you think of Medicare Advantage?" And he said, "I don't like it, but it's the best way you can have coverage as a senior." He told us that and again, this is right from the congressman's mouth. Uh, he felt that when they started the Medicare and Republicans got more control, they said they would not support it unless they started a Medicare Advantage that was an alternative to regular health care. Now, and don't kid myself. Don't kid yourself. Randy still has a few buttons. It's the insurance company's stupid, and we started that. Great Panther started that a couple decades ago, and as Bob told us, that's the problem. It's the insurance companies. But the reality is, he said that there's more money. I have my wife and I have Health Alliance Plan Advantage, and we're patients of we have been patients of Henry Ford Hospital, so it works out perfectly for us. I'm not saying it's right, but I switched from regular Medicare with a in fact at that time I still had the difference covered by my union, but I switched to HAP at the advice of a congressman has introduced he's dead now, but God bless him. He introduced the Healthcare for All bill. That's the very first congressional day in January. Every time he had the same bill number. So I mean, it's something that I understand what's happening, and I think Bob, you're right, absolutely right that my brother's in a situation where he has a serious illness, and he's stuck with the AARP insurance through a Advantage program, and the AARP insurance. That was the guy that got killed a month or two ago. The CEO was killed, but he can't switch because of pre-existing conditions. So it all depends, I think, where you're at. And again, I don't say I know it all about it, but I absolutely took the word of my friend and John Conyers, and it was something that for me the reality of Medicare Advantage. I'm not. We were traveling a lot, and my wife has MS, and so we're not traveling now, but the reality is that the Medicare Advantage, I know it's not what we want, but I do know it's a very good program for a number of Americans. And I now have, through the Henry Ford program, I have now no copays when I go to see the doctor, regular doctor's visits. I'll have a copay when I go see a specialist, a cardiologist like that, but no copay for my regular office visits. I don't mean to be sounding like a Republican, but I'm as Democrat as they come. I'm as left as they come. But there is, when the congressman that pioneered healthcare said that there's some good things about the Medicare Advantage plans. He said they get more money, and again, Bob's right, and the young lady's right. It's taking away money from the regular thing, but I'm looking out for me and my wife. And we've got a pretty darn good plan through Henry Ford, through HAP, the Health Alliance Plan.
Well, thank you.
Well, about 2 years ago, we had a man, again, I'm with the state system, and we get a choice of the Blue Cross Blue Shield Advantage, and they try to encourage us to take that because that's operated by the state. And then we have various other plans. This man, he called me. He was in the Henry Ford plan. And this is about 3 years ago. And it was in October, December. And what happened to him was he had traditionally gotten this test. He had some kind of physical problem, and Medicare, it was covered under Medicare. When he went to the Advantage plan, they wanted to charge him 400 and some odd dollars for it. It's at that point but see, because he was part of the state system, he was able to get back into the state system and sign up for the Blue Cross Blue Shield Advantage, which is the best thing we got going for us now. It's just like you're saying, Dave, it works out for some people. But that one didn't work out for him in Henry Ford. And he had to come back to this one. This one that we have, the state operates it, and they tell them that you're going to cover everything that's on Medicare. Sorry.
Well, we got a couple more hands raised here, so I want to give those people. Linda Fiskus has been very patiently holding her hand up, and then Nick Shimitalskis has got his hand raised up. And then we're really going to be pretty close to the end of our time here, so we're never going to get maybe all of your questions asked. But Linda, what's on your mind? And you are muted.
All right, I just wanted to make sure everyone is aware that Debbie Dingle is holding a Resistance Summit Zoom seminar today at 2:00. Okay. And it's going to cover, democracy, stop Elon, and the environment, climate, LGBT rights, immigration rights, women's rights, education, Gaza, and international aid, and so on. So I put the link in the chat. So if you can just click on that link and register. And it's going to be a Zoom today at 2:00.
Thank you, Linda. A good announcement.
You're welcome.
That's Nick.
Yeah, I just wanted to say we're having some troubles at the state, for the state employees. We're having some trouble now with our Blue Cross Blue Shield, which handles our Medicaid Advantage program for state employees, in that, well, it's not actually a problem with the insurance company, which usually is the case, but not in this case. In this case, we have out-of-state doctors, a lot of them in Florida and some in California, who refuse to bill Michigan Blue Cross Blue Shield. We're self-insured, so we reimburse them, but that means you can get you have to pay the bill and then submit it to the Blues. They get the Medicare rate, but they only pay the Medicare rate at that point. And the doctors, the reason they won't bill them is because they don't want to accept just the Medicare rate. So they charge you more, the doctors are, and then you only get reimbursed at the Medicare rate. Now we're looking into it because we think our state personnel director is doing some extensive work on trying to get this fixed, but it has been a problem recently for Medicare Advantage workers in the state system who travel spend 6 months in Florida and 6 months here in Michigan or it's become a big problem again. So the insurance industry, the insurance industry has been problematic for years, but now some of the doctors, at least out-of-state doctors, are creating a headache for a lot of people as well. So you have to watch out for that.
Thank you, Nick. There's so much we could be covering. We could have a full day conference on this. And so I guess you could call this a Whitman sampler. We're getting an introduction, and we appreciate very much, Bob, the work that you've done to prepare for this presentation. And so if we can all give Bob a special, either a raise of your hand, or if you're in some way or another, let Bob know that we appreciate the work he's done with this. And wanted you to also know that Bob is now our newest Gray Panther member. Every speaker who talks before our group gets an honorary membership, 1-year membership. So
Okay.
So Bob, you're
Thank you.
I will also be mailing you a t-shirt, a Gray Panthers t-shirt. So for those of you on the call who think that Gray Panthers is offering something valuable, I'm going to encourage you to consider becoming a member of Gray Panthers. You go to our website. Danny's been able to maintain that so that, you know, for only $30, you can be a member, or you can be a family member for $50 to bring in your whole family on that. Or if you're an organization, it's $100. So we're very affordable, and want Bob to know that welcome to Gray Panthers. I don't know, but I think, is there one very, very urgent question that we want to bring up, or are we ready to kind of close down this session right now? So I'm going to thank you all for being on the call. Those of you who are on our board, we'll be starting our board meeting in a few minutes. But we'll be talking about, you know, how do we respond to this presentation? It's not just having a lecture. Gray Panther sees itself as age and youth in action. So every time we have a presentation, our board will ask, now what can we do? What is the position we can take? So we're not just nodding our heads at things that might be coming up, and there's always things that we can do something about, either protest or for education, things like that. So,
One thing I'd like to point out is that there's more and more groups that are forming for a national healthcare plan. You know, the nurses have been around, PNHP's been around, Healthcare Now has been around. You have Labor for Single Payer. There's all these groups, and there's more coming. We were told that in order to become a member of the Progressive Democratic Party, you must be willing to sign on to Medicare for All. That's a given. If you're not willing to do that, you can't be part of the progressive movement, because healthcare is such an issue in this country. Thank you.
all right. Well, I think and again, we could be having more conversation, but we started the ball rolling, and thanks again so much, Bob.
Bye-bye.
Okay. Now, those of you